everyone. Thank you for joining me for another Facebook Live. Today is a special event because I'm going to be talking about what's a very difficult topic and something that I was recently asked to speak about at the ASMBS weekend conference here in New York last week. So I did a lot of work preparing for that talk and really trying to get a good understanding of the research on this really important and I think under talked about topic, which is the increased risk of suicide and self-harm following bariatric weight loss surgery. So I know not everybody was able to be at the conference, and the conference was geared mostly towards professionals. So I just wanted to share what I learned from preparing this presentation with you all and give everyone an opportunity to hear what is coming out as a very consistent and steady trend in the research about again, something I think that we often don't talk about, and I will get into a little bit today why that is, why we don't talk about suicide. It's of course a timely topic because we have unfortunately recently had two very public suicides that were covered widely in the media just I think 2 weeks ago. And we know that when there is when there is a public suicide, that does increase the risk for suicide in other people. We see a lot of kind of copycat suicides. I don't know if that's the best way to term it. But really, it's not just about, and that can give people the idea that if we talk about suicide, it's going to increase the risk of suicide, and that's actually not the case. So a lot of the copycat suicides that we see has to do with the ways that the media covers suicide, and I'm not an expert in that, but there's a lot of guidelines and research available online. But what the research does show is that when we do talk about suicide and we can kind of open up a honest conversation about thoughts of suicide that people might be having, that actually decreases the risk that people are going to act on those thoughts. So I think it's really important that we're talking about this, and especially for people who are either professionals working with people who have undergone or are preparing to undergo bariatric weight loss surgery, or for patients themselves who have undergone weight loss surgery or preparing for surgery, or if you have a family member, friend, or loved one who's considering this surgery or who has undergone this surgery. It's really important to know that there is this increased risk coming up that's really been shown in the research. And my understanding from what I've heard from patients and what I've heard from talking to other professionals is that it's not something that people are really being informed of at the surgery centers as they're going through the informed consent. They're kind of told about the risks of anesthesia and the risks of, possibly having a hernia or a stricture or some of these kind of physical complications, but the psychological complications that can happen after weight loss surgery are often not talked about. So patients can feel alone when these things happen. Often they're not taught like what some of the signs and symptoms and early warning signs are, and some of the things that even practitioners should be assessing for in the post-op period. So I'm going to go through some of the research first because I think it's really compelling. So the talk, and I'm going to be, if you see me looking off to the side, I am going to be kind of glancing over at my notes from the talk to just make sure that I'm able to cover everything and give you guys all the information that I gave to the professionals who were attending the ASMBS workshop. And the title of the talk was, and before I begin, I guess I should introduce myself actually for those of you who don't know me. I'm Dr. Alexis Conason. I'm a clinical psychologist. I'm in private practice here in New York City, and I specialize in working with people struggling with different types of overeating disorders and body image concerns and sexual issues as well. And I have a specialty also in working with people who have undergone bariatric weight loss surgery, and my early training was actually in a bariatric surgery clinic. That was my dissertation was one of the first studies to actually find an increased risk of alcohol use following weight loss surgery. So it's kind of a special interest, and I continue to work with a good amount of clients who have undergone weight loss surgery, and so that's kind of a specialized part of my practice, and I stay involved in some of the research in that area. The title of the talk that I gave at the meeting was called, and this title was given to me. I didn't choose it, but I think it's a good one, and I think it's really interesting. So the title was, "If Everything Gets Better After Bariatric Surgery, Help Me Understand Suicide and Self-Injury." They also asked me to talk about eating disorders and disordered eating in that talk, which I did at the meeting. I'm not going to today because I think it's honestly absurd to cover suicide, self-injury, and all of eating disorders and disordered eating in 30 minutes. And I think it speaks to both, I'm happy to see the invitation for these kind of more challenging topics to be covered at the bariatric surgery meetings and within the bariatric community, but also maybe a resistance to really diving into them as fully as these really important topics deserve. I mean, I think that this easily could be a half-day workshop just in terms of how to assess. But anyway, so again, the title was, "If Everything Gets Better After Bariatric Surgery, Help Me Understand Suicide and Self-Injury." So to me, it really poses the question of, does everything really get better after weight loss surgery? And if you work in the bariatric field, or if you've had, or if you're a bariatric surgery patient, you've probably heard the term, weight loss surgery is a tool. It's not the solution. It's not the answer. And I think that even that really doesn't convey the full extent of it doesn't really address the wishful and magical thinking that people tend to have around bariatric surgery. So, I think that we live in such a weight-obsessed culture, and we tend to tie so much in with weight loss. So we think that bariatric surgery is going to help us lose weight, and that will mean, not only that our bodies will be smaller, but that we'll be healthier, that we'll be happier, we'll be more successful, we'll have, better jobs, a better relationship with our spouse. We really anticipate, when we are undergoing, for people who undergo weight loss surgery, this dramatic, complete life overhaul. And often I hear patients talk about it in terms of like, this is the start of my new life. Today is my surgery date is like my birth date almost, it's like a rebirth. So we have, people have really high expectations from this surgery. And I think that in that excitement about what we hope and fantasize the surgery is going to be able to do, we often downplay some of the complications, and we get lost from the reality of what the post-op process actually looks like. And I think that those unrealistic expectations are part of the reason that people might struggle after surgery, because it's very disappointing when we put all of our hopes and dreams into this procedure that we think is really going to be life-changing, and a year, 2 years, 3 years down the road, we find that we're still struggling with many of the same issues. Plus, many people tend to have complications. We may not be able to be really living the life and the dreams that we had hoped the surgery would bring us. And I do think that that might be related to some of the reasons that we're seeing this increased risk of suicide. I think that the unrealistic expectations that everything is going to get better after bariatric surgery happens with bariatric professionals as well. And part of the reason for that is that the patients that are seen in the bariatric clinic in terms of a long-term follow-up are often the best case scenarios. So people who, after surgery, people tend to follow up closely with the surgery center for the first maybe 6 to 12 months following surgery. And then most people kind of disappear. Most people go off and they're not in close contact with the surgery centers. And what we're starting to see in the research literature, that in that first 6 to 12 months, that's not really where people are struggling the most. It tends to be 2 years, 3 years, 5 years, 10 years, 20 years even after surgery, at which point people have usually lost contact with the surgery center. So the surgery centers themselves often aren't really seeing the patients who are coming in with the most severe complications, especially if the complications are psychological, in which case patients are often presenting more to therapists, mental health clinics, mental health treatment centers, as well as eating disorder facilities, although I'm not going to go into the eating disorder piece of things today. So that gives, even bariatric professionals kind of a rosy colored picture of what goes on. And if you talk to someone, for example, who works in a bariatric clinic about what the outcomes are like and how well people do after surgery, it's usually a really different story than if you talk to someone, for example, who works in a substance abuse treatment center who sees a lot of bariatric surgery patients, or someone who works in a eating disorder facility. And some of the eating disorder facilities are actually developing specialized tracks just for people who've had weight loss surgery. So someone who's working in that kind of environment is seeing a lot more of the complications than the surgery centers. And we could get into a whole conversation about why that is, about why people who are really struggling don't come back to the surgery centers. But I'm gonna, save that for another time because I want to stay focused on the task at hand. So I think that, part of the issue is really like, what are the expectations? What are we telling people, and what do people believe is going to happen following weight loss surgery, and how realistic are those expectations? So, suicide and self-harm following weight loss surgery. I'm going to spend most of our time together because our time is kind of limited. And by the way, if people have questions, feel free to write them in the comment section. I'm happy to answer any questions during this session. There was a recent study that came out, and I'm going to spend most of our time today talking about that study because I think it was a large and really well done study. It just came out this year, and it finds pretty much exactly the same thing that a whole bunch of smaller, older studies find. And it's really nice, as someone who is kind of a research nerd, when you look at a body of research and the research is consistent. Like most things that we look into in research, you can find some studies that say this, some studies that say that, usually in direct opposition to each other, and it's kind of hard to make sense of what's really going on. When I reviewed the body of research about suicide following bariatric surgery, it was remarkably consistent, to the point that the same numbers, the same level of increased risk was coming up time and time again by many, many different studies. So, I think this points to that there's a very clear, there's a lot of research that supports that there's a very clear increased risk of suicide and self-harm following bariatric surgery, specifically following the Roux-en-Y gastric bypass surgery. So I'm going to review the study. I can link to the abstract of it in the comments for anyone who wants to get into the science with me and read the actual study. It was done by a group led by, the first author was Neovius. I don't know if I'm saying that correctly, but Neovius and all, from 2018. And they looked at two major databases, both in Sweden, because Sweden has really amazing tracking. They have just great health databases, so it's nice to do research there, because unlike here in the US, where we have no idea what the heck is going on with any of our medical outcomes because we have almost no central databases, in Sweden they have central databases and everything is tracked very succinctly. So looking at one database, which was from what's called the Swedish obesity study, the authors found that suicide and self-harm, when you looked at both suicide and self-harm kind of clumped together as one variable, was 1.78 times more likely following weight loss surgery versus versus a group of people receiving treatment as usual who were similarly matched for pre-op body mass index, so similar weight people. When you look specifically at suicide, this study found 9 suicides, which added up to about 0.48% in the weight loss surgery group versus 3 suicides, which equals 0.15% in the control group. And you can compare that to the national suicide rate in Sweden is 0.01%. So when you look at this by surgery type, what they found was that patients who underwent Roux-en-Y gastric bypass surgery were at a 3.5 times increased risk of suicide, of completed suicide, death by suicide, when compared to the control group. The gastric banded patients were at a 2.4 times increased risk. So it does appear that people who have the Roux-en-Y gastric bypass surgery are at the highest risk of increased risk of suicide, but the other surgeries are also at increased risk. So people who have weight loss surgery, generally are going to be at an increased risk for suicide and self-harm, with the bypass patients at the highest risk. And again, the gastric bypass patients were at 3.5 times increased risk compared with the control group. Now, there is some research showing that people at higher weights do have increased risk of suicide. I think that's because of the tremendously high rates of weight stigma and bias in our culture that makes it really miserable to live as a person of size in our culture, that would lead people to depression and suicide, although not everyone who commits suicide also has depression. But so one of the strengths and one of the reasons I want to focus on this study is that it's not comparing the surgery group to just like a national average. It's comparing the surgery group to a similar group of people who had similar weights but did not undergo surgery. And the study found that the elevated risk was in people both who did and did not have a prior psychiatric history, although it was higher risk in people who did have a psychiatric history. And but it was even seen in people who did not have a prior psychiatric history. And it was not related to weight loss outcomes. So it wasn't because these people weren't losing weight and they were so distraught about that. They lost the same amount of weight as everyone else. So in the same study, Niovis et al. In 2018, they also analyzed data from another Swedish registry called the Swedish Obesity Registry. And they found that when lumped together as a group, suicide and self-harm was 3.16 times more likely following Roux-en-Y gastric bypass surgery when compared with, again, another group of higher weight people who were underwent an intensive lifestyle management. So another type of control group. They found 33 suicides, which accounted for 0.16% of the group in the Roux-en-Y gastric bypass group when compared to 5 suicides, which was 0.03% in the control group, which was a similarly weight matched group. And that database indicated a 5.17 times increased risk. So that's over a 5 times increased risk of suicide. And this is, again, talking about completed suicides people who died as a result of suicide, 5 times increased risk in the Roux-en-Y gastric bypass group. So I'm not going to go through the rest of the data because in the interest of time, but I'll just say that this number, you know, between 2, like the upper, you know, 2.7, 2.8 to 5%, 5 times increased risk, that is consistently shown against across a large number of studies. There's a lot of different references. I kind of went through a number of the different studies in the talk, but I don't think it really is in the best interest of our time to go through them here, just because they all show the same thing. They all show this increased risk of suicide following Roux-en-Y gastric bypass surgery. So this does not mean that everybody who undergoes Roux-en-Y gastric bypass surgery or any kind of weight loss surgery is going to commit suicide. It's a low base rate behavior. So suicide overall is a low base rate behavior. It doesn't happen that frequently. I don't know what the national suicide rate is here in the US. In Sweden, it's 0.01%. I might have the information about the US somewhere, but it's, you know, we're seeing up to a 5 times increased risk. So even if it's just, you know, a 0.16%, you know, percent of the group, or less than 1% of the group, if you're in that 1%, or if you have a family member or loved one who's in that 1%, it's a very serious complication. And that increased risk, I really don't think should be minimized, because it's scary as hell that you're at increased risk of killing yourself after having this surgery. So I think that it's something, you know, that is often minimized because we say, well, it doesn't happen very often. But if you're one of the people that it happens to and that you're at increased risk because you've had this surgery, that's really meaningful. So I don't want to, you know, I don't want to minimize that. I don't want to say that it's going to happen to everybody, but I do think it's something that we should be talking about and informing people of before and after weight loss surgery. I think it should be, personally, I think it should be part of the informed consent, along with some of the other risks that I'm not going to get into, but with, you know, the increased risk of alcohol abuse and the increased risk of eating disorders. So I said I was going to talk a little bit about why we might be seeing this increased risk in suicide following weight loss surgery. And some of the reasons that were given by some of the authors in the research studies included what I started the talk with, which was unrealistic expectations of surgery. This idea that surgery is going to fix all of my problems. And then when we find out post-surgery that maybe we've lost weight, but we still are struggling with a lot of the same issues and maybe some complications or some other issues that might come up after surgery, we feel, you know, it can bring up feelings of hopelessness because we had such high expectations and high hopes for the surgery to be just kind of like a complete life change. And when it isn't, many people feel hopeless, helpless, desperate, and thoughts of suicide can emerge. There's also a lot of body image issues that people struggle with both before and after surgery. We tend to think that losing weight is going to solve all of our body image issues. I can tell you it's not. It just doesn't. And I see this again and again in my practice. People who have had weight loss surgery often struggle with excess skin, which can kind of compound body image issues. You know, if you felt bad about your body and you thought it was because of your weight, sometimes we lose weight, we still feel pretty lousy about our body. So again, it's like a lot of these things that we think are going to be magically fixed with weight loss surgery that aren't. Now, another big proposed mechanism or reason for why we might be seeing this increased risk in suicide, and again, you know, the time frame seems to be a little bit longer term, so starting maybe 2 years, 3 years following surgery. The data was a little bit less clear about that, but it tends to be kind of one of the longer term risks. One of the reasons that we might be seeing that is that people who undergo, and some of the reasons that we might be seeing that people who undergo Roux-en-Y gastric bypass surgery are at increased risk of suicide when compared to the other types of surgeries, is that we're seeing an increased risk in alcohol and substance abuse following surgery, specifically alcohol abuse and opioid abuse. So there's a lot of data coming out. I mean, that could be a whole different talk. Maybe I'll do it at some point. Most recent data showing that the risk of alcohol abuse starts around 2 years following Roux-en-Y gastric bypass surgery and continues to rise until 20 years post-op. It compounds, it gets more and more risk as time goes by. And there is a association of, alcohol and substances that are involved often in suicide because it can increase impulsivity and it can make us more likely to actually follow through on some of those, thoughts that we're having about suicide. And of course, depression plays a role as well. And the idea that the surgery is going to improve depression, there's some research that it might improve it in the short term, but symptoms tend to emerge when we look at over 2 years post-surgery. So what can we do? I think that, we really need, as I've been saying, to be talking about this risk. I think we need to be talking about it openly and kind of normalizing it and decreasing some of the shame associated with suicide. And I think that, providers, whether you are a surgeon, you work at a surgery center, if you are a mental health professional, certainly, if you're a dietitian, primary care is another big another big area in terms of like where people are making contact with medical or mental health professionals post-surgery. A lot of people are just being followed by their primary care physicians. So this risk needs to be really understood by the wider medical community and be assessed for following surgery. So, I think, again, we really have to get over this idea that asking people about suicide is going to increase their risk of committing suicide. It's not true. So if people are not thinking about suicide and we ask them if they're having any thoughts about suicide, it doesn't increase the risk at all. They just kind of say, no, that doesn't really apply to me. I'm not having those kinds of thoughts. And there's no data to show that they would somehow then start thinking about suicide if it had never occurred to them before. However, if we ask someone who is thinking about suicide, if they're thinking about suicide, and we open up that conversation with them, there is research to suggest that people tend to feel a large amount of relief at being asked that question and having the opportunity to talk about these thoughts and feelings and decrease the shame and stigma, and that actually decreases the likelihood that people are going to act on those thoughts. So, obviously the best people to talk about suicide is with a mental health professional. So if you're not a mental health professional, I recommend, having some referrals of people that you can, report people to. And I think that the National Suicide Hotline is a great place to start because they will be able to provide, I think they provide like 24/7 a warm voice on the phone to be able to get people through difficult moments. And they can also, my understanding is, provide referrals to local mental health professionals in the area. So I'm going to post the National Suicide Prevention Hotline to the comments section. So if anybody is watching, is feeling suicidal, or providers who want that information for their patients and clients, you will have that. So I'm just going to end, and I see that Kirby, thanks for joining us. I see that you've um, put a comment here that I think is really important, and I don't want to end without speaking to it, because I think your experience is really common. So you can read her comment to this side. She kind of says that she's 3 years out past surgery and that she's achieved her goal, which I assume means that you've lost the weight that you want to lose. Because usually when people talk about, I've achieved my goal, the goal is about weight loss. And I think we need to stop seeing that as the goal. I think that we really need to move away from this myopic view that weight loss is the answer and move towards a much broader definition of health and wellness. And, you know, even though, so Kirby says that even though she's achieved her goal and that she's outwardly healthy, again, speaking to the idea that we believe that just because someone's at a lower weight, they look healthy when what's going on inside may not be healthy at all. She's really struggling. She feels like she's fallen apart. She's gotten into some eating disorders and disordered eating behaviors, and it's really hard to get the help that she needs. So I would be, you know, happy to, you know, try to provide referrals, but I think that the best thing to do is to seek out a professional in your area, and some ways that you can find a mental health professional. Some people might be thinking, how in the world do I even find a mental health professional? You can look on Psychology Today is a good resource where a lot of different therapists have listings there. You can search by your zip code, and there is also, if you're struggling with an eating disorder, IADAP, the International Association for Eating Disorder Professionals, has a Find a Professional section on their website where you can find a local eating disorder specialist. But I think that one thing that I would underscore is that we really need specialized care. And it's one of the challenges I find in people who are struggling post-surgery is that the specialists in the areas of what people are struggling with either know about bariatric surgery and don't know about these other areas, or know about these other specialty areas but don't know a tremendous amount of bariatric surgery. And I just think it has to do with you know, obviously there's limited people with this kind of specialization in the there's just you know, we're limited in how many professionals we have who are trained in both areas. So, you know, I usually recommend, for example, if you're struggling with thoughts of suicide or depression following surgery, to seek out a mental health professional who is trained in working with depression and suicide. If you're struggling with substance abuse following surgery, to seek out a substance abuse specialist. And if you're struggling with eating disorders, to search out an eating disorder specialist. And Judy, thank you again for joining us and sharing a little bit of your story, which is, again, that she's 14 years out from surgery and finally dealing with some of the emotional issues that, you know, that have contributed to her, you know, to the issues, it sounds like, that caused you to have surgery in the first place. So I think, you know, just to underscore, there's a lot of people out there who are struggling long term. I think often they feel that there is no net. There's no one holding them. There's no one who is, you know, there's no place, because the surgery centers are not really, I hate to say it, but not really that great at, you know, the long-term care. In terms of working with patients, you know, 5 years, 10 years, 15 years, 20 years, and especially when they're struggling with the psychological complications, and there may not be a mental health professional as part of the surgery center. So, you know, I guess I'll just leave you with that note, with the idea that I think when we talk about bariatric surgery, we really need to look at the full picture of what are realistic expectations of the surgery, what are complications that people are struggling with long term, and not to be afraid to talk about some of these more uncomfortable topics, things like the increased risk of suicide, the increased risk of eating disorders, and the increased risk of alcohol and substance abuse. And just to recap, since we're talking specifically about suicide today, that people who have undergone Roux-en-Y gastric bypass surgery might be anywhere between 3 to 5 times more likely to have completed suicide attempts when compared to the control group. To me, that number is staggering, and I don't think it should be minimized. So we need to be on the, as professionals and as patients, to really be on the lookout for what the warning signs and red flags are. And I'm going to post some resources to the National Suicide Prevention Hotline, and their website also provides a lot of information on kind of what to do if you're struggling. If you're watching this and you are having thoughts of suicide, please know that there is no shame in having these thoughts, that many people struggle with thoughts of suicide, especially following weight loss surgery, and that you're not alone and help is available. And I think people tend to kind of dismiss the importance of some of the hotlines, but I know people who literally their lives have been saved by calling these numbers and getting linked up with a treatment professional, and even just having someone to talk to in the middle of the night when things can feel so dark and lonely. So reach out, you're not alone, and I hope that this has been helpful. So I do Facebook Live talks every Wednesday at noon. They are not always, they're not usually about suicide. They're not usually even about weight loss surgery. I talk a lot about mindful eating and helping people resolve their issues around food and body image. If you're interested in learning more about me and the work that I do, you can check out my website. That's drconneson.com. I also offer a completely free 30-day starter guide to help kind of give people an introduction to mindful eating and provide a new way of looking at your relationship with food and your body that is not about weight loss. It's about compassion and self-care and nurturing yourself and living with pleasure and joy. So thank you, everyone, for joining me. I hope you'll join me again next week. If there's a topic that you want to hear about, please feel free to let me know. You can direct message me. You can email me. I'm on Twitter at Psy.D. I'm on Instagram at The Anti-Diet Plan. I'm not hard to find. So I'm glad that you found me and that you've watched this video, and I hope you'll continue joining me. Take care.